Hello, everybody. I'm Osanna from the Chinese University of Hong Kong. Thank you, ICS, for giving us this chance to present here. So I would like to share with all of you about our study on voiding dysfunction and surgical outcome after revision of tension-free vaginal tape-transobturator surgery over a 10-year of experience. First of all, I have no disclosure. TVT-O is one of the most common and known to be effective treatment options for stress-urinary incontinence worldwide. However, voiding dysfunction is also one of the recognized complications from all mid-urethral sling surgery, with different management options described. However, there was relatively lack of standardized treatment with limited evidence. In our unit, we adopted the method of early mobilization and revision of tape tension in case of any voiding dysfunction. However, there are concerns of whether this procedure will reduce the effectiveness of TVT-O. So our aim of study is to investigate the outcome of women who received early tape mobilization due to voiding dysfunction after TVT-O surgery. This is a retrospective analysis of our prospective collected database. All the surgery were performed by urogynecologists or urogyne trainees done in Tertiary Urogyne University Hospital from 2010 to 2019. All the demographic data and preoperative urinary symptoms were collected in a standardized consultation form. All women will receive uroflowmetry and pressure flow cystometry before embarking on TVT-O surgery. TVT-O could be either performed independently or concomitantly with other pelvic floor repair surgery. All the operative records and post-operative urinary symptoms were all collected. If there are any voiding dysfunction, such as with the symptoms of sense of incomplete bladder empty, intermittent stream or straining to void, patient may be put on a revision surgery of the tape tension after ruling out other complications like urinary tract infection or pain. In case any revision of tape tension was performed, all the operative records were documented, with the subsequent urinary symptoms also documented as well. Outpatient follow-up was arranged at 8 weeks after the surgery, then annually after surgery, so that we can follow up their surgical outcome and also if there is any complication arise. Altogether, 680 women received TVT-O surgery over the past 10 years. 24 of them were found to have voiding dysfunction shortly after surgery and were managed by early tape mobilization, with a mean age of around 63 years old, median parity 3, and a mean body mass index of 23.9. And the revision of the tape tension was generally performed from day 1 to day 21 on a median post-op day 2.5. All procedures were performed under local anesthesia, with a mean operative time of around 50 minutes and minimal blood loss. Among the 24 women, 22 of them, around 91.7%, can resume normal voiding very soon afterwards without any significant residual urine, within day 0 to day 3 after the revision. 2 women did require repeated catheterization for further bladder training. One was performed on a day of the revision of the tape tension, and one was performed on around 10 days afterwards. Both women could achieve normal voiding at 3 weeks after the repeated catheterization. The mean follow-up duration for this study is around 2 years, 124 weeks. When we followed up our patient, every woman was satisfied with the surgical outcome, and 91.7% of them did not have any recurrence of stress urinary incontinence symptoms. So only 2 of them had occasional minimal stress incontinence symptoms. 5 of them had urgency urinary incontinence, however, actually only 1 of them being de novo in nature. And no woman required any medical or surgical intervention for their urinary symptoms. There is no more voiding dysfunction or any pain complaint upon our follow-up. So we think that the chance of success of resuming normal voiding after early mobilization of tape tension was actually quite similar to other studies. Early mobilization can help to resume normal voiding with minimal recurrence of stress incontinence symptoms or de novo urgency urinary incontinence symptoms at our intermediate term follow-up. We do believe that longer-term follow-up would be helpful to review if any recurrence of urinary symptoms afterwards. So in conclusion, early mobilization and revision of tape tension is an effective treatment option for women suffering from voiding dysfunction post-TVT-O surgery. An early detection of voiding dysfunction postoperatively is required for early intervention to be possible. Thank you. Thank you.